Good evening to everyone and welcome to today's wonderful evening with Dr. Murali Bharadwaj. NEETPG 2024. Now we are in discussion with the question paper number 5. So it is also available as an ebook with all the mind maps, 200 mind maps of explanatory answers. In the link below, it is available for you to download. Do that today only. Solve the paper before coming to the test, and that will give you a lot of energy every day to discover where you are going wrong, where you need to improve and score better in the real NEETPG exam. Wherever you may take coaching, whatever the app you may be in, but mock test everyday practice with Dr. Murali Bharadwaj will sharpen the saw and make you to become the winner in the tomorrow's exam. With that preamble, let's make the great beginning. Nice to see Ravinder and many more who are all online. Can you please punch his voice loud and clear for all of you? So, doctor, a 28-year-old woman in her third trimester of pregnancy presents with this periumbilical rash. She has no history of any allergy. There are urticarial plaques and tense blisters on her abdomen. So it is a pemphigoid gestationalis. So how did you conclude the pemphigoid gestationalis, doctor? Nice to see Rajesh Raj, Muhammad Hussein, and many more who are all online. Good, doctor. Good. So periumbilical area, blisters, plaques, pruritic is very characteristic. It occurs during pregnancy or postpartum. And there is an autoimmune nature where there are antibodies against the BP 180. BP 180 is what you need to remember. So, pemphigoid gestationalis, commonly abdomen, periumbilical area, autoantibodies, BP 180, which is collagen 17, which is the component of hemidesmosome. Their antibodies. On direct immunofluorescence, you will find linear deposition of the C3, complement C3, and sometimes immunoglobulin G in the basement membrane. So, pruritic urticarial papules and plaques of pregnancy. PUP is a very important differential diagnosis, which you need to remember. Very nice to see 9 online classmates watching. Please inform your friends. Yes. Now, 25-year-old man presents with 6 months history of intensely itchy blisters on his elbow. So this is what you are able to see on the elbow. They're very itchy. Excoriations, papillovesicular lesion on the extensor surface of the elbows and knees. No intact blisters are visible. So all this is pointing towards dermatitis herpetiformis is the diagnosis, doctor. Intense pruritus leads to absence of intact blisters because the patient will try to scratch them. And the skin biopsy with direct immunofluorescence in the dermatitis herpetiformis show granular IgA deposits in the dermal papillae is very characteristic. Dermatitis herpetiformis and celiac disease association. Don't forget, favorite question of the examiner. Similarly, tissue transglutaminase antibodies, though they do not confirm the dermatitis herpetiformis directly. So it is strongly associated with celiac disease. It is an autoimmune reaction to the gluten leading to the IgA deposition in the dermal papillae defines the dermatitis herpetiformis is what you need to remember. Now, doctor, a 45-year-old woman with painful sores in her mouth that persisted for weeks, shallow erosions on her oral mucosa and hands, positive Nikolsky sign. So typically it is indicative of pemphigus vulgaris. Pemphigus vulgaris. There is a suprabasal acantholysis leading to flaccid blisters that easily rupture is very characteristic feature. And if you do skin biopsy in pemphigus vulgaris, what do you see, doctor? We see immunoglobulin G and C3 deposition in the keratinocytes is a very characteristic feature. Now, so every mind map, if you take, doctor, in our ebook, it will summarize all the essential points that you need to remember on that particular topic for the tomorrow's NEETPG exam. So today only, please go to the link below, download the ebook, 50 ebooks of 50 full-scale mock tests. Once you solve and master all the high-yield topics in every mind map, 10,000 questions will give you enough opportunity to equip yourself with all the readiness to become the topper in the tomorrow's NEETPG. So, a 3-year-old girl is brought to the clinic by her parents due to a persistent itchy rash similar to this. It is actually atopic dermatitis. Chronic nature, intense pruritus, eczematous lesions with crusting and weeping, predilection to flexural surface. They're all the characteristic features you need to remember about the atopic dermatitis. A 51-year-old woman presents with 2 months history of recurrent itchy skinny lesion on her trunk. So what you can see here is the typical skin lesions is what you're able to see here, right? So the typical skin lesions. Multiple urticarial plaques with purplish hue on her back and abdomen. It is very characteristic of urticarial vasculitis. Bharatma, nice to see. 12 online classmates, very good, doctor. Practice, practice, and practice. Whenever we join for coaching, typically somebody will come and teach in the morning 9 o'clock to night 9 o'clock, totally taking away the energy, juice, adrenaline, everything out of you. Those classes are waste and useless, honestly. You won't register anything beyond 2 to 3 hours. What you need is the right material, the right set of questions to practice, the right concepts, a summarized notes format. Silently, you need to finish this 50 full-scale grand tests. Identify the topics. In every mind map, you have all the important necessary related points available. So just to download the ebook, it will only cost you $500. but that will give you what examiner is going to exactly give you in the tomorrow's exam. So the urticarial lesions with a livid purplish hue that persists and may leave bruising or hyperpigmentation is very characteristic of urticarial vasculitis, is what you need to remember. 45-year-old woman presents with several months history of persistent swelling and discoloration of her nose. She described her lesions as reddish purple, slightly raised, itchy, and you can see the lesion on her nose. There is a violaceous, indurated, scaly swelling across the bridge and sides of her nose. What is it most likely to be? It is the lupus pernio in sarcoidosis, which is a chronic violaceous, indurated swelling in the nose with a scaly texture. With a scaly texture is what you will be able to see. Why not rosacea? Rosacea has flushing, telangiectasis, papulopustular lesions, not indurated violaceous lesions. Lupus erythematosus has a malar rash. Rhinophyma has a bulbous enlarged nose with a reddish color and rough texture, is very characteristic, is what you need to remember. A 52-year-old man, diarrhea, weakness, painful rash on his legs, poor dietary intake. After giving treatment with niacin, it has improved. So it is a classical feature. Dermatitis, diarrhea, history of alcoholism, poor diet. They're all the predisposing factors for the development of pellagra, is what you need to remember. So every NEETPG has at least 40 to 50 image-based MCQs, which are very easy to crack if you have a good practice. 32-year-old with 3-day history of widespread itchy rash. She is on amoxicillin for a nasal sinus infection. Following that, she developed this rash, doctor. Now, she has an exanthematous drug reaction. Erythematous maculopapular rash after the amoxicillin therapy is characteristic of a exanthematous drug reaction. It is a T-cell mediated hypersensitivity immune response, is what you need to remember. Now, doctor, a 60-year-old with history of atrial fibrillation, slate gray discoloration of the skin. So what is that, doctor? It is amidaron associated hyperpigmentation. So you should know everything, anything about amidaron. So amidaron lead to phototoxicity, which is typically on the face, particularly the forehead. You find slate gray colored pigmentation, is what you need to remember. 38-year-old with 1 week history of fever, painful skin lesions. She reports no recent travel. Multiple edematous, erythematous flocks on her trunk and thighs, which are ulcerated and have pustular appearance. Of the lesions, is what you are able to see. So now, doctor, so this acute onset of the fever, painful, erythematous, edematous, red, flocks with ulceration, pustulation, trunk, proximal limbs, with a recent history of the sore throat, is characteristic of Sweet syndrome. Usually, it is a recent upper respiratory tract infection. There is a dense neutrophilic infiltrate on histopathology. Hyderma gangrenosum also has ulcerated lesions, but there is no acute febrile onset. There is no dense neutrophilic infiltrate, which is more characteristic feature in case of Sweet syndrome, is what you need to remember. So everything, anything about sweet syndrome. In the same mind map, I give you the whole list of things. Edematous, red blocks, fever, arthralgia, leukocytosis with hypersensitivity, infection to the infection, malignancy, or any medication with neutrophilic infiltrate, which is very characteristic of sweet syndrome, is what you need to remember. A 52-year-old presents with the history of painful mouth ulcers that heal without scarring. And also you are able to find condyloma lata. No, this is not condyloma lata. Oral aphthous ulcers were there. Following that, there are genital ulcers. Genital ulcers. And she also has a blurry vision, redness in the eye. So combination of recurrent oral genital ulcers with the ocular involvement and history of systemic symptoms means it is Behçet's disease. Vulva, vagina, cervix in females, penis and scrotum in males, painful ulcers often with a similar appearance in the mouth. So that is called Behçet's. In Behçet's, what do you do? Pathology test. Eye examination. These are the important things that you basically do in the Behçet's. 34-year-old woman presents with long-standing history of painful lump in her back, on her buttocks, on her thighs. So she developed extensive scarring, tunneling into the skin. So it is hidradenitis suppurativa. Why not acne vulgaris? They don't lead to extensive scarring and sinus tracts, which is the main differentiator, is what you have to remember, doctor. Now, a 3-month-old infant with a history of repeated febrile episodes treated with short course of antibiotics. An X-ray of chest had been shown to you before and after the treatment. So, what is the most likely diagnosis? New heart murmur, the presence of an enlarged heart, pulmonary edema, they all suggest acute aortic regurgitation because of the bacterial endocrinitis is what you need to remember. Now, doctor, 56-year-old man presents with fatigue, swelling in the legs, echo was done. There is a severe tricuspid regurgitation with a jet velocity. So, this is a severe tricuspid regurgitation. Right, doctor? So, right ventricular systolic pressure of 64 millimeters of mercury. The moment there is a tricuspid regurgitation, all the extra blood is falling back from the right ventricle back into the right atrium, and that ultimately lead to right ventricular hypertension, which is the predisposing factor for the tricuspid regurgitation, is what you need to remember. So peak jet velocity of the regurgitant blood of 4 meters per second means significant tricuspid valve backflow with elevated LV systolic pressure is a very right ventricular systolic pressure is a very characteristic feature. A 65-year-old has fatigue, swelling of the legs, difficulty in breathing, and a radiograph has been shown to you. So what is the most anterior among the chambers of the heart, doctor? Right atrium and right ventricle is immediately behind your sternum. So right heart border is bulging to the right with increased curvature. Such a significant right atrial enlargement, which you are able to see, is very characteristic feature of tricuspid stenosis, which is very severe, is what you should remember. Now, patient is admitted into the hospital. with a history of fever, new heart murmur, painless erythematous lesions are noted on the soles and feet. Retinal hemorrhages with pale center. By now you should recognize we are talking about the systemic features of the infective endocarditis. So Janeway spots are the painless erythematous lesions on the soles. Roth spots are retinal hemorrhages. Along with positive blood culture for Staphylococcus aureus means it is acute bacterial endocarditis is what you need to remember. A patient presents with shortness of breath, fatigue, leg swelling, diastolic and systolic 2D echo shows dilated cardiomyopathy. Dilated cardiomyopathy, where the ventricles, biventricular systolic dysfunction with dilated ventricles, with the spontaneous contrast in the left ventricle, along with the clinical presentation of the ventricular failure, heart failure, with shortness of breath is very, very characteristic feature, doctor. Patient has acute sharp chest pain that decreases when sitting up and leaning forward. ECG, what is it showing, doctor? The ECG in this given case, in multiple leads, even non-contiguous leads, it is showing diffuse ST elevation along with depression of the PR segment. PR depression with diffuse ST elevation. ST elevation in V4, V5, V6, multiple leads, which is very characteristic of acute pericarditis. So ST elevation, PR depression is a very characteristic feature of acute pericarditis is what you need to remember. Now, a patient's history of COPD presents with palpitations. So what do you see here in this ECG? So before coming to the class only, try to take it like a mock test in a real exam condition. So irregular PP intervals, atrial rate more than 100 beats per minute. In the same lead, one P wave is upright, another P wave is inverted. Different P wave morphologies indicate multifocal atrial tachycardia, which is very common in the patients who are having COPD, is what you have to remember. A patient on the ECG shows tachycardia. So what you are having? You are having tachycardia. And upon giving typically, once you have used adenosine, it will induce a transient AV block and then it will reveal the underlying atrial flutter. So fundamentally, atrial flutter was there. You are not sure what is the type of tachycardia that he is having, but you have given adenosine and induced a transient AV block, and that brought out the atrial flutter is what you need to remember. So that's the reason adenosine has an ability to unmask the atrial flutter whenever the patient is having supraventricular tachycardia is what you need to remember. A 17-year-old unrepaired ventricular septal defect, a chest radiograph has been done to him. A chest radiograph has been done. So what is a very characteristic feature you are able to see in this chest radiograph, doctor? Typically, there is an enlarged pulmonary artery, which is very, very prominent. So whenever a VSD patient has a prominent pulmonary artery, means he developed a pulmonary hypertension. Normally, VSD is a left to right shunt. But the moment pulmonary hypertension becomes significant, the left to right become right to left shunt, because right-sided projects will rise. and that lead to a cyanotic VSD translating into cyanotic condition, which is called Eisenmenger's complex, is what you need to remember. Elevated pulmonary resistance secondary to ventricular septal defect leading to reversal of the shunt is what you are able to see, where the radiograph is showing the presence of a enlarged pulmonary artery is what you are able to see, doctor. Now, a 4-year-old boy brought to pediatricians due to cyanotic episodes during feeding or crying. He has a heart murmur, clubbing of the fingers, right? A boot-shaped heart. What you can see? Boot-shaped heart, which is very characteristic of tetralogy of Fallot. And on crying, the pulmonary vasospasm will worsen the cyanosis, is what you need to remember. So everything, doctor, about tetralogy of Fallot, I condense important points into one mind map and provide to you so that your revision become very, very easy. So today only, go to the below link, download the mind map just by paying 500 rupees, or pay 10,000 rupees to join for 50 full-scale grand tests. So every grand test we release one ebook, and that has got 200 mind maps. So most important thing, this 50 grand tests will make you to do the revision of 10,000 questions. And it is my promise to all of you that these 10,000 MCQs, once you practice along with these mind maps, 10,000 mind maps in this 50 ebooks, tomorrow's 200 questions in NEETPG automatically come from this. So that is the reason today only go to the link below, click on that, you will end up in learnograph.com. There all the ebooks are being published and you can do the revision of the full-scale grand tests. So discussion on the YouTube is free. But before coming to the class, if you solve the paper and then come to this, that will give the greatest yield for you. We all waste a lot of money and join this app, that subscription, this plan, that plan. Ultimately, unless we consume all that content with the motivation, how will we get the seat? Competition is cutthroat. 2 lakh people into 2 eyes means 4 lakh eyeballs are looking at the first 1,000 ranks. I want all of you to be in that 1,000. For that, you don't need to break a big bridge or a hill. Just this 50 full-scale grand test, ebook download karo learnograph.com se, practice karo. Before that, and evening I'll do the discussion. Discussion में participate करो, पूरा 200 mind maps का revision करो, बस you will get the seat in the next 60 days, doctor. Now, let's go to the next question. Now, a young woman has painful red nodules on her buttocks. She has a family history of lung and liver disease. There is a paniculitis with neutrophilic infiltration. So, painful red nodules on the buttock, low serum levels of alpha-1 antitrypsin, family history of lung and liver disease, skin biopsy showing lobular paniculitis with neutrophilic infiltration. They're all the characteristic features of alpha-1 antitrypsin deficiency, is what you need to remember. Now, doctor, a patient presents with a shoulder pain radiating down to the arm. and the hand muscle weakness. And what is MRI showing, doctor? MRI is showing a pan-coast tumor, which is encroaching upon the brachial plexus, is the characteristic feature. So the combination of shoulder pain, muscle weakness, large tumor in the left upper lobe, the brachial plexus, compression, they're all the features of the pan-coast tumor. 58-year-old chronic cough, shortness of breath, chest radiography is being shown in the figure. Chronic cough. So what do you see? A pneumoconiosis is what you are able to see. So typically coal mining industry may काम करना. Large bilateral masses, lung shrinkage, angulation of the left hemidiaphragm. Left hemidiaphragm is showing angulation. They're all because of the lung fibrosis, fibrotic masses, which you see in the case of the coal workers, pneumoconiosis, the characteristic X-ray you cannot miss. 42-year-old patient with the history of HIV with dry cough, shortness of breath. So what are you able to see, doctor, here? X-ray and the CT. Typically, there's a patchy distribution, ground glass opacification, which are interstitial pathology in a retroviral patient. Characteristic of pneumocystis carinii pneumonia is what you should remember. Patient has hematuria, proteinuria, elevated creatinine, renal biopsy show immunofluorescence. Typically, you are able to see the histopathology. Crescents are present. So what are crescents? In the Bowman's capsule now, you have parietal epithelial cells and the podocytes. These parietal epithelial cells, when they proliferate with infiltrating leukocytes, they encroach into the Bowman's capsule space. They are called crescents. So, doctor, what you are seeing here, segmental necrotizing glomerulonephritis with crescent formation with the minimal immunoglobulin complement deposition, which is called the Wegener's granulomatosis, typically lead to pauci-immune glomerulonephritis, which is of a rapidly progressive nature, is what you need to remember. Now, doctor, a patient presents with hemoptysis, renal impairment, renal biopsy, and immunofluorescence has been shown to you. So this kind of a ribbon-like linear deposition of immunoglobulin G on the GBM is very characteristic of the good posture syndrome, where there are antibodies against the glomerular basement membrane. Patient has dyspnea on exertion, ECG is done. So what do you see in this ECG? So before coming to the test discussion only, you should solve it. So there is in the lead 1, it is looking down. Lead 3, the QRS is looking up. That means there is a right axis deviation. Along with that, in the lead V1, normally R waves will not be this prominent. If they are prominent, means there is a right ventricular hypertrophy. So right ventricular hypertrophy, right axis deviation. There are peaked P waves. The P waves are peaked. Typically in the inferior leads, that is 2-3 AVL, there is a peaking of the P waves. So these are all characteristic of right atrial hypertrophy. So together the patient is having a advanced pulmonary hypertension with the right axis deviation, right ventricular hypertrophy, right atrial hypertrophy, prominent V wave, R waves in the lead V1. V1 is a right-sided lead. V1, V2, V3 are V1, V2 are right-sided. V5, V6 are left-sided leads. So typically you find a prominent R wave only in the left-sided leads because the electrical axis passes from right towards left. But if the right-sided lead is showing a prominent R wave, means कुछ गड़बड़ है. वो गड़बड़ क्या होता है? Typically, whenever there is right ventricular hypertrophy. So now, doctor, a patient has progressive difficulty swallowing, difficulty, weight loss, and you have done endoscopy, right? And also barium. So what are the radiological findings, doctor? Bulky mass is there in the mid esophagus, in the mid part of the esophagus. Narrowing of the esophageal lumen, irregularity of the esophageal wall. So this is all suggestive of squamous cell carcinoma. The most common location being the mid esophageal area is what you should remember. So that completes 30 image-based questions, doctor. Now, let's go to the serious business of the other questions. 7-month-old infant with a failure to thrive and recurrent bouts of diarrhea. It is the lactose intolerance due to deficiency of the lactase enzyme is what you should remember. 10-year-old child with chronic diarrhea while consuming the dairy products but not with the other foods. There is a problem in sugar metabolism. Which sugar is likely responsible? So typically contains lactose, which is composed of glucose, and galactose is what you need to remember. 3-year-old with lethargy, hyperammonemia, especially after a protein-rich meal. Protein metabolism leads to hyperammonemia. Hyperammonemia, ammonia need to be converted to urea. For that, first thing is what? Ornithine transcarbamylase need to work. So it is the ornithine transcarbamylase deficiency, most common urea cycle disorder. So you should know everything, doctor. Carbamyl phosphate synthetase 1, rate limiting enzyme of urea cycle. And it requires N-acetyl glutamate as allosteric activator. Ornithine transcarbamylase, it catalyzes citrulline formation from carbamyl phosphate and ornithine. Arginine ultimately hydrolyzes arginine to urea and regenerates the ornithine. 42-year-old found unresponsive in a home in Mumbai is pronounced dead. So, what is true about the investigation? Coroner cannot impose fines or punishments post-investigation in Mumbai. The coroner cannot impose. Coroner's inquests are not held in Mumbai. 32-year-old with black eye after falling and hitting her forehead. So bruising can occur in areas away from the actual site of the trauma. That's called ectopic bruising. So what is a bruise? Extravasation of the blood into subcutaneous. Because of the subcutaneous vessel rupture is called bruise. Ectopic means away from the point of impact site. For example, in the black eye. And what tissues are susceptible to the bruises? Soft, loose, vascular areas like face, breast, vulva, scrotum. Bruise you don't find on the palms and soles is what you need to remember. 30-year-old man comes to emergency. He was close to an underwater explosion. Now he has a ear pain. He has abdominal distension. So what is he having? Ruptured tympanic membrane and gastrointestinal perforation. So the primary blast injury from underwater explosion typically affects air-filled structures like the tympanic membrane. 38-year-old comes to the clinic, inability to maintain an erection with the current partner but not previous partners. So code Hank refers to impotence with a specific partner, which is because of the psychological component. A 45-year-old male with a blue line on the gums, excess salivation, memory issues. He works in a hat manufacturing unit. And what is that, doctor? Occupational exposure to hat manufacturer. Presence of blue line in the gums. Memory issues, that is all chronic mercury poisoning. 30-year-old with hot, dry skin, dilated pupils. So typically excess anticholinergic activity, which you see in the case of datura ingestion, hot, dry skin with dilated pupils, blind as a bat, delirium, mad as a hatter, are the classical signs of the anticholinergic syndrome. And physostigmine is considered to be the treatment of choice. 65-year-old with hypertension, diabetes, according to the steps, most important to reduce risk of non-communicable disease, smoking. So smoking, alcohol, diabetes, hypertension ka very predisposing factors. Now, if you want to report the number of deaths and the lethality of a disease, what is the best measure? It is the case fatality rate. So everything you should know, doctor, rate versus ratio versus proportion, what are they? What is infant mortality rate, maternal mortality rate, sex ratio, incidence, prevalence, case fatality rate, relative risk. All this I leave you in one single mind map with which you can be able to do the revision. A hospital administrator is evaluating the different management methods to improve hospital efficiency. Of all, which is most important thing, cost benefit analysis to evaluate the financial efficiency of different decisions by comparing the cost with that of the benefit. Tomorrow, some of you are going to run the nursing homes. A public health official, the population, high-risk population, to identify and control the spread of TB. What type of screening you want to do? Prospective screening typically is done by the health authorities to identify the asymptomatic carriers in order to prevent the further spread. Prescriptive screening is for the individual's benefit, whereas prospective screening is for the community benefit, is what you need to remember. A public health researcher is analyzing the impact of the midday meal scheme. Midday meal scheme, the primary objective is to attract the children to the school and improve the literacy. So improvement in literacy is the way to assess the efficacy of the midday meal program. National Urban Health Mission. Which indicator would be appropriate to measure the success of NUHM? It is the decrease in the prevalence of the communicable disease among the street children is the way by which you can be able to calculate the impact caused by National Urban Health Mission. A 30-year-old comes to the clinic after stepping on the nail, non-penetrating, less than 6 hours, last tetanus toxoid boosted was 7 years ago. What is the next step? You administer 1 dose of tetanus toxoid. So what the patient is having is a clean minor wound and received a course of tetanus toxoid more than 5 but less than 10. They should receive single booster dose of tetanus toxoid. So I leave the literature for you. What are the immunity categories? What is the treatment? Depending upon the type of the wound, duration of the injury, etc., etc. A 10-year-old is brought to the clinic after being bitten by the stray dog. The dog has not been caught and wound is a puncture on the forearm. So what do you want to do? Most important thing, thorough cleansing of the wound with the soap and water. A 2-year-old is brought to clinic for immunization. Measles, we use the Schwartz strain commonly used. RA27/3 for rubella, 17D for yellow fever, Gerillin strain for mumps. All these quizzes, kaun banega PG pati, BCG, Danish, OPV, P1, P2, P3, measles, Edmonton Jograve strain is most common. Mumps, Gerillin, Rubella RA27/3, yellow fever 17D, varicella okay, Japanese encephalitis Nakayama, Beijing SA 14 14 2, swine flu A California, malaria SPF 66 strain called Lytic cocktail and PF 25 strain. All these things, stupid things. But for the entrance, yes, sir, you need to ratta maro, batti maro. There is no other way. I leave this to you in a single mind map. Last moment of revision के लिए, ठीक है doctor? Epidemiologist is evaluating the demographic trends of a country in the past decade. The total fertility rate has decreased and is now close to the replacement level fertility. Bhaiya, replacement level fertility kya hota hai? When the NRR is equal to 1, TFR is approximately 2.1. That means each generation is being replaced without any further growth is what you need to remember. So I leave the literature for you. What is NRR? What is replacement level fertility? What is total fertility rate? Everything you should be very, very sure of. A public health officer is evaluating regional TB control program. So, which index he should use? Prevalence of the sputum positive TB is the most important index for determining the impact of the control programs of TB on the prevalence in community, especially among specific age group like adolescents, is what you need to remember. Epidemiologist finds there is a decrease in incidence over 10-year period of population. So secular trends reflect long-term changes in the disease pattern. Seasonal trends are short-term related to environmental factors. Cyclical trends are fluctuations over periods longer than a year and related to change in the herd immunity, antigenic variation, not vaccination coverage is what you need to remember. So seasonal trend, cyclic trend, secular trend, everything you should know before you go to the NEETPG. I leave all this as a mind map for you to do revision in one shot. A local health department is notified of a sudden increase in the patients presenting with symptoms of acute gastroenteritis. All have attended same banquet 24 hours ago. That means it is called point source epidemic. Propagated ongoing transmission beyond initial cases. So all these definitions, doctor. Point source epidemic. First of all, epidemic means excess of expected based on endemic frequency. 2 standard deviation from endemic frequency defines it as a epidemic threshold is what you need to remember. Always in epidemic, first step is to verify the diagnosis. In point source epidemic, it is also called common source. Cases develop within one incubation period. There is an explosive rise and fall with no secondary waves. Bhopal gas tragedy, Minamata disease, they are the examples of point source epidemic is what you need to remember. So, doctor. So I like to tell all of you that wherever you might have taken coaching, it doesn't matter. But in this last 60 days, take the 50 full-scale grant tests, solve it in an exam condition, and then go through 200 mind maps. Like that, in 50 tests, 10,000 MCQs ka revision ho jayega, 100% strike rate. So today only join this program. There is a link below. You can directly go to the link and download each test by paying 500 bucks, or you can pay 10,000 rupees and get the entire 50 full-scale grant test. Discussion is free, absolutely free on the YouTube, right? हम सब मिलेंगे, मजे में पढ़ेंगे. Now, doctor, To know the effectiveness of the screening program of the TB, the identification of asymptomatic carriers or early clinical disease, where the intervention can prevent the progression and reduce the burden of the disease. So that is the whole purpose of the screening programs. In a clinical trial, a new drug is being tested. 2% of patients taking new drug had a stroke compared to 4% in placebo group. So what is absolute risk reduction? 4% minus 2% is equal to 2%. So the number needed to treat is the reciprocal of absolute risk reduction. So 1 by ARR, 1 by 0.02 is equal to 50. Right? So the correct answer should be option B. Right? So absolute risk reduction, number needed to treat, number needed to harm. These are the three parameters you should know, doctor. Number needed to treat is 1 by ARR, whereas number needed to harm is 1 by attributable risk. That is the fundamental difference. So in a study, I leave the literature for you. I will go to the next question. 33-year-old man with history of IV drug abuse, fever, chills, new heart murmur, urine analysis shows RBCs, protein. What is the cause? Typically, it is infective endocarditis, common in IV drug abusers. So, drug-induced vascular spasm is the one which is responsible. 72-year-old with atrial fibrillation and warfarin therapy, she is scheduled for evaluation of protein S levels. So, if you want to know protein C, protein S deficiency, withhold the warfarin for 2 weeks and then only you should check protein C, protein S. Otherwise, warfarin will interfere with the assessment of the protein C, protein S. So I leave to you. We use warfarin for thrombophilia. What are vitamin K dependent factors? 2, 7, 9, 10. Warfarin typically affects vitamin K dependent anticoagulants, including protein C, protein S. Not only 2, 7, 9, 10, which are procoagulant, protein C, protein S, which are anticoagulant, are also vitamin K dependent. That's the reason warfarin is a vitamin K antagonist. That's the reason it will even affect the protein C, protein S levels, is what you need to remember. Now, doctor, 63-year-old, history of diabetes, shortness of breath, fever, cough productive of yellow sputum, systolic BP of 90, heart rate 110, bounding, peripheral pulses. So whenever you are in sepsis, there is an intense vasodilatation that leads to the development of hyperdynamic circulation, is what you need to remember, characterized by the bounding pulses. 38-year-old, new onset seizure, MRI show multiple cystic lesions, characteristic of neurocysticercosis. 29-year-old, elevated T4, suppressed TSH, does not have goiter, any ocular changes. That means Graves' disease ruled out. So what is the underlying cause? She is taking weight loss medications. A lot of times, weight loss ke liye, the so-called quacks, they give thyroid. That exogenous thyroid hormone intake you should elicit in the history, which can lead to suppressed TSH with the elevated T4. 68-year-old with a history of hypertension, diabetes, shortness of breath, BNP is elevated, third heart sound, S3 is appreciated. That means she has got a congestive heart failure, which is peripheral edema, is indicative of right heart failure, which is most important feature consistent with CHF clinically, is what you should remember. 55-year-old male with a history of snoring, daytime sleepiness, presence with dyspnea. Holosystolic per lower left sternal border. So what is the cause? So the moment you have obstructive sleep apnea, there is a pulmonary alveolar hypoxia that lead to pulmonary vasoconstriction, that lead to pulmonary hypertension, that lead to right ventricular pressures high, that lead to tricuspid regurgitation. Tricuspid regurgitation, secondary to pulmonary hypertension, secondary to obstructive sleep apnea is what you have to basically remember, doctor. Now, a 24-year-old woman comes to the emergency. She has got a narrow complex tachycardia without any visible P waves. Vagal maneuvers are tried. So always EKG symptoms of supraventricular tachycardia, lack of visible P waves, regular narrow complex tachycardia suggests AV and RT. AV nodal reentrant tachycardia is what you should remember. 44-year-old woman with sarcoidosis. Her 24-hour urinary calcium is elevated. So sarcoidosis causes, say, ectopic calcitriol production. Who produce that in sarcoidosis? Macrophages, which are activated, produce calcitriol, and that calcitriol lead to hypercalcemia, which is the feature of sarcoidosis, is what you need to remember. So sarcoidosis and hypercalcemia, types of hypercalcemia, everything you have to master down. 25-year-old, widespread rash, non-itchy maculopapular lesions. So gray mucus patches, that is all the classical feature of secondary syphilis, with the rash involving palms, soles, and mucous membrane is what you need to remember. 34-year-old with history of Raynaud's phenomena with progressive dyspnea on exertion, loud S2, parasternal heave, right ventricular hypertrophy. These are all the features of the right ventricular failure secondary to pulmonary arterial hypertension. So what is the main reason leading to the death in systemic cirrhosis? Typically, systemic cirrhosis lead to the development of the typical pulmonary arterial hypertension that lead to right ventricular hypertrophy. 6-year-old with 10-year history of systemic cirrhosis with progressive dyspnea. So she develops pulmonary hypertension is one of the important complications of systemic cirrhosis. 45-year-old kidney transplant. So which regime you will give to prevent post-transplant infections? We give Bactrim DS, oral trimethoprim sulfamethoxazole for the pneumocystis carinii pneumonia prophylaxis we give in the immunocompromised people. Either it can be post-transplant or because of the cancer chemotherapy, or in all these scenarios. A 50-year-old with 6-month history of fatigue, depression. Her blood test shows a serum calcium of 11.2. No history of kidney stones or fractures. Any chronic asymptomatic hypercalcemia with the elevated PTH, only think about primary hyperparathyroidism. So you should know very well that the differential diagnosis for primary hyperparathyroidism, how to differentiate, everything I leave to you in one mind map for you to do the revision, doctor. A 30-year-old woman, 12 weeks pregnant, Lyme endemic area. You will think of Lyme disease, Borrelia burgdorferi. Pregnancy may you can't give doxycycline. Pregnancy may amoxicillin. So doxycycline for non-pregnant, amoxicillin for pregnant women is considered to be the treatment of choice. 19-year-old athlete, heart murmur, harsh mid-systolic murmur that increases in intensity when she goes from squatting to standing. When you stand, what will happen? There's a decreased venous rhythm that will decrease the size of the ventricle. When the ventricular size is decreased, if the murmur becomes more louder, that is a classical indication of hypertrophic obstructive cardiomyopathy. A harsh mid-systolic murmur increasing with the maneuvers like standing, The decrease the ventricular volume is very characteristic of HOCM, is what you need to remember. Once more, doctor. I discussed all these things in our regular video library on the Score Learning app. Today only subscribe, or any coaching program where you attended earlier will give all these basic funda on differential diagnosis for different types of systolic murmurs, everything. But you need to do the revision, understand the concepts very clearly. So now, doctor, how does a functional murmur, aortic valve murmur, ASD murmur, hypertrophic cardiomyopathy murmur, tricuspid agitation murmur, all these things I leave in one mind map for you to remember for the tomorrow's exam, doctor. A 32-year-old man is evaluated for heart murmur found incidentally. High-pitched blowing murmur immediately following the second heart sound. So he has no symptoms of dyspnea, chest pain, or syncope. So early diastolic blowing high-pitched murmur is characteristic of aortic regurgitation, and best way to evaluate that would be by doing the esophageal echocardiography is what you should remember. A 55-year-old with 20-year history of type 2 diabetes presents with progressive fatigue, swelling in her extremities, laser treatment for retinopathy. So any long-standing diabetes with proliferative diabetic retinopathy with albuminuria means it is diabetic nephropathy, is what you should remember. A 65-year-old man, hypertension, history of cardiac surgery, and sawtooth flutter waves means atrial flutter. To prevent stroke, he should be started on anticoagulation therapy. A 40-year-old woman with persistent unilateral leg swelling. So whenever there is a DVT, post-thrombotic syndrome should be managed with exercise and compression to improve the venous return. Otherwise, it lead to disastrous effects on the limb, which had deep vein thrombus. A 45-year-old man with a history of hypertension and obesity, severe pain in his big toe, that means acute gout. Always acute gout may never ever give allopurinol. Never give. You give only NSAIDs. Allopurinol should be given either prophylactically, chronically, but not during acute episode. Please don't forget it. Acute gout attack is managed with NSAIDs like indomethacin. 52-year-old with swelling and pain in the left calf and Doppler ultrasound confirms DVT. What is the next step, doctor? Initiate oral anticoagulation therapy. First line treatment of DVT is always anticoagulation. Only if the anticoagulation is contraindicated, then we give IVC filter. 23-year-old sexually active man, painful swollen left knee with a rash, synovial fluid show septic artery. Always, any young man with a monoarticular arthritis, young individual, ask for a history whether he has gone to red light area in Bombay or Bangkok. Neisseria gonorrhea is the underlying cause of the septic arthritis. Monoarticular presentation in a young individual is what you should remember. 29-year-old with irregular menstrual cycles, excessive facial hair growth. All the signs of the polycystic ovarian syndrome. What is the initial treatment, doctor? Combined estrogen, progesterone, oral contraceptives are the ones that need to be given. A 29-year-old, irregular menstrual cycles, same, PCOD. Now, 60-year-old with history of chronic cough, weight loss, shortness of breath, right-sided pleural effusion, elevated LDH. Always a low glucose, elevated LDH in pleural fluid means it is rheumatoid pleurisy, is what you need to remember. 45-year-old, sudden onset of the red eye on waking up. Subconjunctival bleed is there, but BP is still normal. Any subconjunctival hemorrhage is self-limiting, usually resolves without treatment. 42-year-old male with a history of type 2 diabetes, decreased libido, but BMI normal range, no liver disease, elevated serum ferritin, elevated transferrin saturation. So serum ferritin elevated, transferrin saturation elevated means iron overload along with the decreased libido, erectile dysfunction means there is a hypogonadotropic hypogonadism, which is hereditary. Hemochromatosis is what you need to remember. 55-year-old diabetic has got a limited active and passive range of motions, which is classical of the stiff shoulder, adhesive capsulitis, which is predisposed by the diabetes. So this looks too fast, doctor, but let me tell you, if you solve these 200 questions before coming for discussion, then this discussion looks very easy. If you don't solve, just come extempore, it looks like I am running very fast. But I have no choice but to run very fast. 49-year-old, joint pains, microcytic anemia, elevated lead levels. How do you treat? Lead toxicity, calcium disodium EDTA is the agent which is used to do the chelation, is what you need to remember. Now, doctor, 53-year-old with hypertension, control hydrochlorothiazide and lisinopril, takes 3 alcoholic drinks every day. His BP is elevated. Unless you don't stop drink, your BP doesn't stop. So, patient's alcohol intake is the one which is contributing to his elevated blood pressure, is what you need to remember. So, when you are a consultant, you get all kinds of patients. So, we have one corporated morning to evening like a fish he drinks. His BP is 190, 200. Already was using 80 milligram telmisartan, 50 milligrams of metoprolol, 100 micrograms of clonidine, still not controlling. What is the cause? Daru need to be controlled. 68-year-old woman with 3-month history of progressive memory loss, myoclonus, behavioral changes, periodic sharp wave complexes is the highlight of this clinical vignette. Creutzfeldt-Jacobs disease. 47-year-old with a history of alcoholic dependency comes to the emergency, tremulous, agitated, seeing insects crawling on the walls. So classic symptoms of alcohol withdrawal, which is treated with intravenous benzodiazepines, is considered to be the primary treatment. They activate the GABA A receptor, replacing the effect of alcohol. Long-acting benzodiazepines can prevent the withdrawal complications. You need to be very sure. 35-year-old, 2-month history of hand tremors that worsen to when reaching the object. Taking sertraline for depression, tremor does not progress and is symmetrical. So, subtle initiation and lack of tremor progression suggests a medication-induced cause. Right? So, physiological tremor, typically up to 20% of patients on SSRIs can develop a enhanced physiological tremor, is what you need to remember. A 22-year-old, overwhelmingly sleepy. She feels like she's dreaming just before falling asleep. Muscle weakness, whenever she laughs, she gets weakness and falls back. So what is that? Narcolepsy, excessive daytime sleepiness, hypnagogic hallucinations, cataplexy. The combination is called narcolepsy. Modafinil is the first line treatment for reducing the daytime sleepiness in narcolepsy, is what you need to remember. 50-year-old with ankylosing spondylitis, localized tenderness on the T7 vertebrae. So any ankylosing spondylitis developing osteoporosis from chronic inflammation can end up in vertebral fracture even with minimal trauma is what you should remember. 52-year-old comes to clinic with flaccid blisters, Nikolsky positive. She was diagnosed with lung cancer. So what is this, doctor? Flaccid blisters, positive Nikolsky is indicative of pemphigus. Paraneoplastic pemphigus is antibodies against desmoplakin. So I leave, doctor, each mind map will give you the complete analysis of the things you need to remember for example. Desmosomes are destroyed in, basically desmosomes provide adhesion between adjacent keratinocytes. In that, desmoglin antibodies are typically seen in staphylococcal scalded skin syndrome and bullous impetigo, IgG pemphigus. Desmoplakin is destroyed in paraneoplastic pemphigus. Desmocholine is destroyed in IgA pemphigus. It's also called subcorneal pustular dermatosis. Then hemidesmosomes connect the basal keratinocytes with the basement membrane. And typically they are affected in bullous pemphigoid antigen 2 is what you need to basically remember. So now, doctor, a 38-year-old woman presenting with flaking crusted lesions on her face and chest, hyperkeratosis, parakeratosis, but preservation of the granular layer, classical of actinitic keratosis. Hyperkeratosis, focal parakeratosis without acantholysis is equal to actinitic keratosis is what you need to remember. 6-year-old boy with severe sunburn, minimal sun exposure, classical of xeroderma pigmentosum, which is nucleotide excision repair defect. Whenever the ultraviolet induced DNA damage is there is what you need to remember. 10-year-old boy, 2-week history of pruritic scaly ring-shaped rash on the arm. He has got a pet cat, which is also having similar patches on the fur. So these annular lesions with a central clearing and peripheral scaling, characteristic of tinea corporis is what you need to remember. A 30-year-old complains severe itching, intensifies during night. He's in a crowded hostel. Typically, there are linear markings between his fingers and several vesicular lesions on the wrist. Burrows, nocturnal pruritus, characteristic of scabies. So, doctor, out of remember, out of 200 questions in the tomorrow's NEETPG, 180 questions are predictable. Whenever you go to any hill station, honeymoon, Sunset Point, Eco Point, Suicide Point, Sunrise Point, whether you go to Shimla, Nainital or Ooty or Kodaikanal, anywhere the same points, you will say big voice, I love you, and the hill also will resonate, I love you. Similarly, every NEETPG, one question on pemphigus, one on psoriasis, one on OCPs, one on TB, one question on carcinoma cervix, carcinoma ovary, carcinoma endometrium, carcinoma lung, carcinoma liver, apoptosis, one question on P450 users and inhibitors, like that. There are only 1,000 topics from which 180 out of 200 questions come. You need to get the practice done. Practice of these questions. You should know what are the high-yield topics. Any coaching program's fundamental intention is what? To make you orient, not necessarily teach you, but orient towards those 1,000 high-yield topics. If you are not oriented, not the problem of coaching program, it is our problem. We enrolled, but we did not do the revision homework to master that. So a lot of students join the coaching programs, apps, big study material they order, but where are they consuming? They are not able to do that. So my job, Dr. Murli Bharadwaj, is a classmate, roommate, tablemate, benchmate. Hold your hand, walk with you every day, take you to the reading room, download the ebook, share with 2-3 friends surrounding you. 1 by 3 to 4 share, no problem. But you do solve the paper of the mock test and come to the discussion, please. I'm always there to inspire and assist you to push 100, at least 100 questions I discuss. So you get inspiration to consume all the 200 mind maps that I give in the ebook. So there is a link below. Today only go and download it. By paying $500, you get a mock test and start solving, start following me on the YouTube, on the Instagram, and I will take you to the path of the success doctor. So we'll finish few more questions before we say good night to each other. So, doctor, a public health officer, what is the strategy most effective to identify and manage new cases in STDs? Contact tracing of the diagnosed patient's partners. That is, a prostitute's client list should be taken in order to do the contact tracing. 45-year-old with diabetes, scheduled for elective surgery. Patient is unable to completely oppose the palms of his hands together. His neck circumference is measured at 18 inches. So what does it indicate? It's a challenged intubation. So what is that called? The prayer sign is associated with difficult intubation, particularly in diabetic patients. So Wilson's risk score, prayer sign, inability to place both palms flat together suggests difficult intubation. Submandibular, limited submandibular compliance, Dalton's warning sign, testing the extension at the atlanto-occipital joint. Neck circumference, more than 17 inches in men, 16 inches in women, suggests difficult intubation. 63-year-old with COPD, currently breathing room air with a SAT of 88%. So, which oxygen delivery system provide most appropriate oxygen therapy by allowing precise control of F5? Venturi mask. It's very important in COPD patients to avoid CO2 narcosis. A simple face mask does not allow for precise FiO2 control. So Venturi mask, simple face mask, non-breathing face mask with reservoir and one-way valve, high flow systems, ambient air, second line options, everything you should be very sure doctor. 60-year-old man with severe frostbite. You are doing stellate ganglion black. How do you know it is successful? Stellate ganglion is a sympathetic ganglion. So warming of the skin on the affected hands is a very important indicator, is what you should know. So Horner syndrome, flushing of the face, injection of the tympanic membrane, increased skin temperature and lacrimation, stiffness in the nasal mucosa called Gutman's sign. They're all the signs of a successful stellate ganglion block is what you need to remember. 70-year-old undergoing abdominal surgery is given neuromuscular blocking agent for muscle relaxation. So it is a depolarizing neuromuscular block. So how do you know? If it is a depolarizing block, phase 1 block, There's a depression, single twitch height, train of forefade is absent, tetanic fade absent, post-tetanic facilitation absent, less blockade by non-depolarizing drugs. There is non-depolarizing block, there's a depression of single twitch, train of forefade, tetanic fade are present, post-tetanic facilitation present. So you should know how to differentiate depolarizing from non-depolarizing blockade. Very, very clearly, I leave the literature to you in one mind map for you to do the revision for the tomorrow's exam. 30-year-old woman is scheduled for a minor surgical procedure. Which anesthetic will cause a differential blockade? That means sensory blockade with sparing of motor blockade is the feature of the bupivacaine is what you should remember. To maximize shelf life of the packed RBCs, what do you give? Saline, adenine, glucose, mannitol, SAGM will extend the storage of the packed RBCs up to 42 days. A psychiatrist, what is the difference between DSM-4 and DSM-5? Multi-axial system. What is multi-axial? Dividing into 5 axes, the entire psychiatric disorder is being totally said goodbye, removed in DSM-5, which is the major change. 68-year-old women brought about her memory. You have done MMSC. Now the question comes, what are included in MMSC? So MMSC is a 30-point test for cognitive function. Takes less than 10 minutes. Orientation, check the time and place. Ramaya, where are you? I am in Sri Lanka or in India. Check time for place. Working memory, ability to spell words backwards. Episodic memory, 3-word recall. Attention calculation, serial 7s, 10 minus 7, 93 minus 7, 86 minus 7. Then language, naming objects. This is pen, this is ball, this is muku, this is chevi. So naming objects, visuospatial skills, copying a design. So there are all the components of the MMSC which has got a maximum score of 30 is what you need to remember. A 7-year-old boy, recent history of being extremely upset at school drop-offs. His mother reported that his grandfather, with whom he is very close, passed away 2 months ago. His teacher reported that he is often tearful, distressed, frequently complains of stomach aches, separation anxiety. So a boy's distress at parting from his mother, physical complaints in the context of school, recent loss are characteristic of separation anxiety disorder. 17-year-old, significant weight loss, excessive exercise, irregular menstruation, physical exam findings of bradycardia, hypotension. They're all the features of anorexia nervosa is what you should remember. 32-year-old, he has not used heroin in the last 24 hours. His vital signs show elevated BP. So it's all opioid withdrawal. So detoxify with methadone. Naltrexone is opioid antagonist and would precipitate severe withdrawal symptoms if given during acute withdrawal. Buprenorphine is also used for detoxification, but the high-dose maintenance therapy is part of the long-term treatment, not immediate withdrawal management. A 45-year-old female with a history of bipolar disorder has been on lithium therapy. What are the side effects of lithium? Hypothyroidism. So what are all the side effects of lithium? One of the favorite question of the examiner doctor. Leukocytosis, postural tremor, hypothyroidism, nephrogenic diabetes insipidus, fatigue, weight gain, not weight loss, acne, renal toxicity, Epstein's anomaly, if given to pregnant mother, Epstein's anomaly. And what are the uses of lithium? Acute mania, prophylaxis of bipolar mood disorder, cluster headache also lithium, chemotherapy induced leukocytosis, we use the lithium, SIADH lithium, cyclical vomiting lithium is used, Huntington's chorea it is used, and it has an anti-suicidal ability is what you need to remember. During hospital orientation, why do people wear lead aprons? To decrease the exposure to radiation. Ultrasound is the preferred initial modality for renal calculi because of its ability to detect the acoustic impedance without any radiation exposure. 72-year-old with stiffness and pain in his back. So, flowing ossifications along the anterolateral aspect of the contiguous vertebrae, classical of diffuse idiopathic skeletal hyperostosis. 12-year-old boy with a high BP, figure of 3 appearance on the aorta, classical of coarctation of the aorta, for which you do MRI of chest. 60-year-old with history of difficulty swallowing, weight loss. Hide-bound appearance of the small bowel, where there is a loss of the normal intestinal fold pattern because of fibrosis, is a feature of the gastrointestinal scleroderma. 52-year-old with a diagnosis of cervical cancer. So what is meant by point A, doctor? Paracervical triangle, where the uterine artery crosses the ureter. So all about the points, doctor. Point A, paracervical triangle. Point B, pelvic side wall and obturator nodes. Totally 80 gray at point A, 60 gray at point B, 40 to 50 gray by external beam teletherapy and rest by brachytherapy. So please don't forget this funda of managing the radiotherapy, doctor. So which component of the gamma camera responsible for detecting photons? Sodium iodide scintillation crystal is the primary radiation detection element in gamma camera. 45-year-old with the paralysis of the auricularis posterior. So auricularis muscle is supplied by facial nerve. Trigeminal for mastication muscles. So all these cranial nerves, doctor, definitely asked. So if you look at the pinna, posterior auricular artery, superficial temporal artery, they are arterial supply. And venous lymphatic go to parotid and upper deep cervical lymph nodes. Great auricular nerve, lesser occipital nerve are the ones which supply the pinna, is what you should remember. A 30-year-old musician comes to the clinic. There is sensory neural hearing loss, means cochlea is involved. Foramen of Huschke is a feature in temporal bone that usually closes by the age 4. Utricle is the part of the vestibular system that senses the horizontal linear acceleration, is what you should remember. Now, tinnitus, hearing loss are indicative of ototoxicity. Chloroquine is the one which is known to have the ototoxic effect. So you should know very well everything, doctor. Aminoglycosides. In the aminoglycosides, high ototoxicity, neomycin has highest incidence. Amikacin, gentamicin are also ototoxic. Ototoxic drugs lead to hearing loss at which frequency? High frequency, more than 8,000 hertz. Dihydrostreptomycin effect, cochlea, streptomycin effect, vestibule. Aminoglycosides, cisplatin, carboplatin are known to lead to permanent ototoxicity. Salicylates, chloroquine, quinine, furosemide, ethacrynic acid, they all lead to relative reversible ototoxicity, is what you should remember. A 25-year-old pilot had got hearing loss after rapid descent of his last flight. So ototic barotrauma may nasal decongestant and autoinflation maneuvers are the ones which are initially recommended. 55-year-old female with a history of giddiness, hearing loss in her right ear, sensation of fullness in the same ear, nystagmus induced by hearing loud sounds. What is that called? Tulios phenomenon. So vertigo, tinnitus, sensory neural hearing loss. Where do you see? Menias. In Menias, you see Tulio's phenomenon. Vertigo and nystagmus induced by loud sounds is called Tulio's phenomenon. 23-year-old with nasal trauma. Displaced nasal bone fracture. How do you want to do? Reduction of the nasal fracture within 3 weeks. So non-C3 fractures without CSF leak can be reduced in 2 weeks. So direct blow in the front suggests a horizontal septum fracture, which is Jarjabe's fracture. Absence of CSF leakage rules out class 3 fracture. That's what you need to remember. I leave the literature for you, doctor. How do you classify the various fractures of the nose? So once more, I want to tell you, doctor, every mock test is an ebook. Make it a point to download the ebook by paying $500. Sit with 2-3 friends. You can share the PDF with your friends, no problem. But all of you sit, put an alarm, practice the test, come to the discussion. 200 mind maps of 200 question explanatory answers will give you thorough revision on the very high yield topics. 45-year-old woman, swollen reddish nose, acne rosacea, bulbous nasal growth. What is that? Rhinophyma is what you should remember. 27-year-old professional singer, which cartilage least likely to undergo ossification? Epiglottic is elastic and does not typically ossify, unlike hyaline, thyroid, cricoid, and arytenoid. 45-year-old, persistent, rough and low-pitched voice, history of vocal strain, false vocal cords are partially closing during speech. It's called dysphonia plica ventricularis, where rough, low-pitched voice aligns. Typically, those who have vocal strain. 16-year-old comes to the clinic. Symptoms suggest of STDs. So her mother says, "Is my daughter having STD? Can you tell?" "No, sir." You can't advise the mother that no information. You need to advise the mother that, sorry, we cannot give information unless the daughter gives the consent. Minors are entitled to confidential care for STIs without parental consent. A neonate has bilious vomiting, abdominal distension, not passed meconium, abdominal X-ray show dilated bowel loops, no gas in the rectum. No gas in the rectum means the Hirschsprung's disease. So administer a gastrographin enema. So I leave the literature for you, doctor. How does the baby present? How do you evaluate? What is the diagnosis? How do you know the severity in Hirschsprung's disease? So, doctor, that brings us to the end of the today's session. Study, study, study. Peacefully, without any tension. Padana, bhulina, bhulina, fir padana, fir bhulina. Ratta marna, batti marna is the part of the game. Enjoy it. Right? I'm there with you every day with the full-scale grant test, ebook to do practice along with you. Good night and enjoy with a sweet dream that you are going to be in the top 1,000 ranks, going for the counseling in a government medical college. Oh my God, what a spirit. Always be in that high spirits. Good night.